Hello, doctors and medical students. Welcome to our second podcast, and thank you for all the support. Our doctors community creating a lot of discussion, a lot of content on academic aspects, but we are lagging behind to create discussion and content on other aspects of life as a doctor in this society. That's what exactly we are going to do in this platform. If you are not following it till now, do it right now. We are going to learn a lot from this platform. In every episode, we are going to discuss one important topic which will be very useful for the doctors. In this regard, today we are going to discuss about medical certification. For that, today we are with none other than Dr. T.N. Ravishankar, one of the leading medico-legal expert in India.
Thank you.
I will name the list of certificates. Can you please tell us the best practices as well as important considerations while issuing the certificate? Number one, leave certificate for students.
Students, it's a very easy one. The only thing is the schools are misusing the medical fraternity. Like a professional, like a office, they are eligible for 21 days. Mm-hmm. Even if the grandmother dies at home, every parent will come and ask you a leave certificate saying that the child was sick. Mm-hmm. It's a right on the part of the family member to light and give it that because of the grandmother's death or grandfather's demise that the child required 3 days of holiday, and why should they come to a medical fraternity? That it's a one that is there. Any director of school education in any states in this country has given the provision of 21 days and beyond that also as an eligible leave that a child can take when they are coming in a single academic year, which always the schools will demand. And it is very easy that this is the situation where we always oblige to the parents giving a leave certificate. 3 days, 5 days, 7 days, it's okay. There are children who have some psychiatric ailments and at that point of time might demand it for a longer time. At that point of time, it is right on the part of a family practitioner to request a psychiatrist to give a certificate of that nature, because this psychiatrist certificate will help the child in one way or other to pass over or tide over the standards, the academic year. They can change over from the academic year. There are times when a general practitioner certificate will not be valid if it is being challenged by anybody else in the court of law, or if it is being challenged in the school health department and all these things. And for giving a certificate for school, we always are too leisure, lethargic, or we don't take it too seriously, but that also can create problem. Something in the family, a marriage or anything, you can always refuse telling the parents to write and give it because of the marriage sequence and family they have taken leave. As a medical practitioner, let's be very fair, very straight, being within the legal framework, whoever they are. Let's follow the law that is existing in the country.
Sir, in my experience, I've seen parents asking for medical certificate for 1 or 2 days for LKG or first year students.
This is only to try to escape answering the headmasters that giving a certificate by us, it makes it easy for them.
Next, medical leave certificate for employees.
It has to be very, very careful. We have already told about it. Specific dates, depending on the ailment, how long the individual might take to recoup from the ailment. Some will take 3 or 4 days. Some will take a week's time. Some will take more than a week's time. Depending on it, at a given point of time, don't try to give it more than 7 days or 14 days. As usual, everybody will come for 30 days. No. A general practitioner can give it only for 30 days, or a physician can give it only for 30 days. If it is beyond 30 days, it has to be authorized by a government doctor working in service. That only will be more valid. Because of trying to go to a government hospital and try to get it difficulty, they always come to the nearby family physician or a physician to give leave for more than 30 days. Give it for 7 days or give it for 14 days and then ask them to come back, assess them and then try to give it or extend it. Or you can give a fitness certificate that you have to join on that particular day. Beyond that, I don't think the patient is going to come and nag you to get a false certificate.
Okay, sir. Next one, fitness certificate for driving. Renewing driving license.
Yes, 2 major things has to be, sir. The visual acuity and the color vision is the 2 things that has to be there. Even a disability can always be added. What is the disability they have? It depends on the inspectors who are assessing them whether they can drive the vehicle, whether they can use the clutch plate or all whatever it is. All depends on them. But what is a disability? You can always mention it. You have to check it with the Snellen chart whether the color vision is proper or not. And driving license, After 60, has to be renewed every 5 years. That has to be very, very careful. When you are trying to give a driving license certificate, then it means that you are allowing a person to drive on the road and every other person is safe and that person is driving on the road. That has to be there, and the age has to be really designed. Trying to give a certificate for an younger person to drive, allowing that person to misuse the road is going to give harm to a lot of populations who are there using the road, and they need to be very careful when you are trying to give a driving license certificate fitness. It is very important to add the exact correct blood group of the individual in the driving license, because something happens on the road, this license is going to help him for the other people, to help him out if he is in a dire need of a blood. At that point of time, trying to find out what is his blood group, or if you have written a wrong blood group, you are going to get into trouble. So you need to be very, very clear that before you go to a doctor to get a driving license, you need to have your blood group certificate along with you, so that it is appropriately entered in the form that is being provided by the Government of India.
Next one, pre-employment fitness certificate.
You need to assess whether the person is going to be a manual labor wherever he works, or he is going to be on a shift duty, or he is going to be using his brains like the IT industry or whatever it is. If it is going to manual labor, you're going to check out his muscle mass, his ability to work for hours together, and if he is going to, whether he is suffering from a non-communicable disease or not. If that is going to be there has to be certain amount of restrictions for him. Depending on that, you need to advise them and then provide a fitness certificate. And if they can't do a shift duty, like that they're taking on an anti-epileptic drugs, or they are on too many drugs for them to maintain their normal life, I think shift duty should not be there. You cannot provide them a fitness certificate when they are applying for a shift duty. Whenever somebody is asking for a fitness for employment, demand the letter that is being asked by the company or the employer, because you will not know who is asking them, but you may know the company has got a shift duty. In that situation, demand the letter of offer that is being given to the individual, whether it is going to be a regular duty or a shift duty. And similarly, somebody who is unfit for a night shift, you can clearly mention that the individual cannot do night shifts. This has to be taken care, and this is there. You are trying to do something good for the individual also. Don't try to think that you are trying to provide him an employment of that nature. A poor cardiac reserve, you have a very poor ejection fraction. Somebody who has got a valvular disease, which is not common nowadays, but earlier it was there quite prevalent. You have a valvular disease with poor ejection fraction. An epileptic, a psychiatric illness, on long-term medications, on several medications. These are people who has to be really assessed well before they have been provided certificate, that too particularly when they are trying to use their brains for long hours sitting and working. You have a cervical spondylosis person, you have an ankylosing spondylitis patient, and they are going to sit hours together in a shift duty. And also the travel that involves from his place of work to his residence also has to be taken considered. You please advise them to get a residence near the place of work, so that they walk there to that place and all these things. Rheumatoid arthritis patients working for long hours, cervical spondylosis, working with the brachial neuralgia, all these things also will have to be assessed.
Okay, the next one is fitness certificate for food handlers.
That's a very important one. Somebody who has got an infectious disease, somebody who has got tuberculosis, somebody who's a carrier of salmonella. Food handlers will have to have a proper, neat and hygienic physique. Even if his physique otherwise, at least his limbs has to be very clean and neat. And if he has got any infection in the limbs, or if he has got an infection in his respiratory tract or in his oral cavity, it has to be taken care before he is being given a fitness to work as a food handler. That has to be taken care, because by the way of his aerosol, by the way of his speech, by the way of handling food, he can spread the infection to other people, and that has to be very, very careful. Food handlers has to be given very thoughtful examination, or you might have to do some blood evaluation before giving them a fitness certificate, so that it's a very, very sensitive area where you are preventing the infection from spreading from one person to another person in the society.
So do you think you have to give them deworming before giving food handlers, certificate to the food handlers?
Yes, of course, that will be a good protocol, a standard protocol. You may not know whether he has got a pet at home. That's a very important when you're trying to give a certificate for somebody who's handling food. You need to ask them whether he has got a pet at home. It's not the pet alone. Maybe they have birds and all these things. They live along with it. They have been living with it. If they are so, I think it is better that you examine the respiratory tract, give a clear-cut standard protocol of anti-deworming, and then ask them to get the certificate from you.
So next one is school yearly certificates. Parents used to come to doctors for yearly fitness certificate for the children.
There are some schools which demand the fitness certificate. Probably they are trying to be very, very defensive in their in their system. That they
handing
want
over
a
the responsibility
to like what you said, handing over the responsibility to the parents and to the doctor who takes care of their family, that the child is fine and good. Anytime, any problem can happen at any part of time in their life. But then at that point of time, the patient was sick, and that is why we always say when they are trying to give a certificate, the component what you asked earlier, that at that point of time, the child was clinically normal. That is why date, time is all important for that.
And next one is, recently the students used to come to doctors for certificates before going to tournament or some joining NCC, something like that. So what thing we should consider before?
That's a physical fitness. Age, what we have said earlier about going for a sports event, whether the person is 16 years and above, 14 years or above, that has to be there. And physical fitness again. There are times when the child joining the NCC or the scouts in the school, that they for the first time find out that he has got a hole in the heart. He might go for a parade, feel dizzy, fall down, then come to a doctor, they examine and find it out. That is how the system probably came into existence, that before you join the NCC or scouts, that they need to get a medical certificate. There are times when a doctor, in spite of good auscultation, will not be able to pick up. A small murmur can always not be heard all the time. It may be heard only when the patient has got a tachycardia or something and the heart rate is high. At that point of time, they can detect it. But there are times when the murmurs get masked. That will be the time that you can always miss it. So better try to examine appropriately. Tell the entire exam, the physical examination is very important before you give a certificate for joining any physical and manual hard work for any child.
It is better
and
to
you also assess the anemic status of the child. The girl children must be seen and screened for an anemia as far as possible.